Hi, Louise.
Hi, how
My
are
name,
you?
I'm great, thank you. My name is Jackie Horton, and
Nice to meet
it's a pleasure to meet you as well. Before we get started today, I wanted to tell you a little bit about myself. I'm a student at A&T State University. I'm studying clinical psychology. This is my second year, and I'm really, really excited about it. There's another thing that I need to talk to you about before we get started as well, and that's confidentiality, all right? I want to assure you that all of your sessions will be held in the strictest of confidence, but there are a couple of caveats, and those are that if you infer in any way that you are going to possibly hurt yourself or someone else, then I would have to report that to the appropriate authorities. And also, I have to let you know that our sessions will be shared with my supervisor, and that's for your benefit so that we can make sure you receive the proper care, okay?
Okay.
All right, so let's get started. Tell me about yourself and tell me why you're here.
Well, lately I've been having depressive thoughts. I've been unmotivated, crying all the time, and I really don't want to do anything. I have difficulty sleeping, and it's just been hard for me to take care of my son lately. I've been irritated with him, and I'm starting to feel like a bad mother.
Well, first of all, let me just say that, you know, as a mother myself, I've felt that way often. But I do see that you were referred by your general practitioner, and that she had prescribed you some medications for depression. Okay? And so tell me about the medications. Do they work or not?
I don't really think they're working.
You don't really think they work. So are you still taking them, or did you take yourself off of them?
I'm still taking them. It's just from time to time.
From time to time, but not as recommended?
No.
Okay. All right. And so you say that when you have low motivation and not enough sleep, that it makes you irritable, right? And then, of course, you react with your son in a way that doesn't make you feel well, right? Okay, so can you tell me about that? What type of actions toward your son bothers you?
I've noticed lately I'm very cranky with him. I snap at him fast, and I have to realize that he's just, 2 years old, so I have to be more patient. But from a lack of sleep, I'm always irritable, and my mind is just always racing on other things, and I know that he needs different nurturing and care, and right now I'm not able to provide him with that.
So tell me, I'm hearing you say that you don't feel like you are adequately able to give your son what he needs right now.
Well, financially I am, but not emotionally.
So you don't work?
No, I don't.
Okay, all right. And is the father in your son's life?
No, he's not.
He's not. What about other family members?
I have my mom and dad, of course, and most of the time they'll get him too, but you know how that goes.
So tell me about that. How does that go?
Sometimes they don't mind keeping him or helping me out with him. Other times I feel like I'm being a burden to them, so I'd rather just keep him myself. But I don't think it's fair to him that I have him in that type of environment or around me when I'm not feeling up to par.
Okay. So I'm hearing you say that you feel guilty about taking your son sometimes to your parents because you don't want them to feel like they're overloaded.
Yes.
Because you share that same feeling of the overload. But you also feel guilty about how you would treat your son when you get agitated.
Yes.
And while you were on the medications, that didn't help at all?
In my opinion, I don't think it
I
did.
don't think it did. Okay. So now, when you talk about being concerned about your son, I know that you stated that you scream at him a lot. Do you hit him, or
No, I don't.
you don't hit him? Do you ever feel like you might want to hit him?
Yes, but
You do?
I know that's overboard.
Okay.
Once I feel like I'm gonna hit him, I usually walk away, and then I feel like I'm neglecting him, emotionally, and being supportive. If I yell at him, he cries, and I just walk away. But I'm wearing thin.
That has to be hard. I can imagine being a single parent, how that must feel, having to solely care for your child. And it can be stressful, so I understand that too. But you also mentioned that you have thoughts of suicide.
Yes.
Okay, and how often do you have thoughts, like 20 times a week, 30 times a week?
Maybe about 15 times a week.
About 15 times a week.
You're looking at 2 or 3 times a day.
Do you have a plan? Have you ever sat down and have made out a plan to
No.
kill yourself?
Certain things just come across my mind. Like flipping over the car or drinking myself to death. Pills.
So you mentioned drinking and pills. Do you abuse those substances? Do you use alcohol?
I abuse alcohol
Okay, and how often do you drink alcohol?
every day.
And how much alcohol a day?
Maybe a fifth.
A day. Okay. And you didn't want to share this with your general practitioner because you were afraid that your son might be taken away from you. Is that correct?
Correct.
Okay, so when you talk about wanting to escape, wanting to get away, wanting to commit suicide, what are your thoughts about your son when you think about that?
One side of it is that he's not going to have to deal with me mistreating him at a young age, but the other side of me is like it's unfair to him to grow up without me. But as of right now, I feel like I am not a good mother to him, and he deserves a better mother.
What do you consider to be a good mother?
Someone patient and that's not dealing with their own problems. A mother that doesn't want to commit suicide every day, and that doesn't drink every day.
And do you see any solutions to not thinking about killing yourself or not drinking any alcohol?
If I can just cope with certain things from the past or things that have happened, if I can just get over those.
So tell me about some of those things in your past that have happened that triggers.
Well, the relationship with my parents and also with my son's dad just leaving us, and I'm having to take care of him and provide for him on my own.
So you feel a sense of, is it fair to say that you feel a sense of abandonment? What about your parents? Do you feel any abandonment toward them? How's your relationship with them?
I mean, it's a surface level relationship. I feel like they're there for me now just because of Thomas. They were upset with me for having him. I was in school, but of course that's all gone now. I don't really think they want to do anything for me. I think they're doing it just for my son, to be beneficial to him. And if they know that I was having these thoughts, they would probably take my son away or help those people get my son.
So if you were to imagine the perfect life for you, what would that be?
The perfect life for me.
Or at least one that's satisfactory. Let's just stop there.
I would be in a different environment, around different people, and I really would like to be around different people. Yes. Non-judging. I would like to be more carefree, but you can't absolutely be carefree with a child. So I feel like I've had my early 20s and younger life just taken from me. I feel like I had to do, it was just moving fast. Mm-hmm. My friends they're in school or they're just living and traveling, but I'm not able to do any of those things.
So why are you not able to go to school?
Just not focused anymore.
So do you think that if you were more focused, you would consider going back to school?
Yes, sir.
So tell me about your relationships, your friendships. You say you would like to be around different groups of people.
I have good friends. I'm more so talking about just in this area in general. just the everyday people that you see, the environment, I would like to be around something nicer and calmer, and where people are kind of diverse and different from myself. But my friends, they're very supportive, but a lot of times I don't want to call them with my issues because they have their own life going on.
So if you were going to take your life, how would you take your life?
I probably would flip the car over.
And you've thought about that, Tom?
Yes, I see it as being something easy to do.
Well, I think there's help for you. I think there's a solution for you, but it's going to require you making some decisions, or allow me to help you to make some decisions. Are you up for that?
Yes.
So first, I would like to have you assessed further, okay? Because I don't want you to kill yourself. I'm obligated, because you've mentioned that you might, I'm obligated to have you further assessed, just to make sure that you won't, but also to make sure that you're getting the proper treatment that you need to make you be able to handle the anxiety or the depression or whatever it is that's sending you over the top. And let me just say, many parents experience